Welcome, welcome. It's so good to see everybody. I will give everyone a few minutes to join. It is Wednesday, March the 3rd, which is crazy that we are already in March. So happy to be here, excited to have everybody joining. We have lots of different updates, lots of things we'll go through. But as always, first and foremost, please say hi, tell me where you're joining from. And if you have any questions, please make sure you post them in the comments pane right there on your right. First and foremost, thank you guys for joining. As many of you know, for some that are your first time, this is Live with Liz. This is a seminar or webinar, whatever we want to call it, that I do every other Wednesday at 12 p.m. Eastern Time, 11 Central Time, which is where I'm at here in Houston. It really is an opportunity for us to get together as an OCD community, for me to share some insight that I might have, and of course for us to spend some time discussing OCD, giving some background, hopefully helpful education, resources, and tools. But really, it's important for us to recognize that this is not intended to replace therapy. So the point of these webinars is for them to be education-based and for me to answer questions that I can from a personal or maybe professional perspective, but not to give specific treatment advice or intervention. So you'll see me often refer back to a therapist, because it's really important you're working with your own therapist, as treatment is always individualized and is something that's different for every single one of us. A couple of announcements that we have today. I'm going to hop right in, but first and foremost, if you're feeling unsafe, suicidal, or you cannot confirm your safety, it's critical, if you're in crisis, that you call the National Suicide Prevention Line. That's here in the US. If you're in another country, you'll want to call your local line. Call 911 or your emergency response line wherever you live, or of course proceed to your nearest emergency room. IOCDF and the work that we do is not crisis-based, and we are not equipped to handle a crisis. If your safety is at risk and you're in crisis, please make sure that you follow these steps to keep yourself safe. Safety is number one. So as always, please post some questions. Hi, Aaron. Thank you for posting. Hi, Zedric. I will get to those shortly. I will start with announcements and then hop into questions that were pre-submitted, and then get to the questions that are submitted live today. So a couple of updates, and this is the first time I'm announcing this. It's with a heavy heart that I am announcing it, but it is something that was made with best intentions and a decision that we made to keep people safe. But the International OCD Foundation, due to ongoing COVID restrictions, has made the difficult decision to cancel the in-person conference this year in New York City. It was scheduled for July of 2021, and while we are very disappointed, we certainly are going to be having a lot of online conferences and events, and you can see that schedule by visiting iocdf.org/conference. I know this is hard news for many of us because the conference is a place that we connect, that we gain amazing education, support, resources, and tools, but we have done the best that we can to make an informed decision to keep to keep all of us safe, but also to make sure that we're still going to have amazing ways to support the community, and that is going to be through our virtual events this year. It is our full intention that we will be back in person by summer of 2022 for our conference in Denver, and I know I'm excited to see so many of you and hopefully be able to be in close contact and be in a different situation at that point, but at this time we had to make that decision due to safety. Anxiety in athletes. So many of you know that we have started a new initiative. Tom Smalley, one of our lead advocates, is really helping head up and lead an initiative focused on anxiety and OCD symptoms that we see specifically with the athlete population. We have a survey that we're asking those to provide some resources, complete it, fill it out, so that we can have a good understanding. This is a needs assessment. You can go to surveymonkey.com/r/anxiety in athletes. We ask that those of you with OCD would complete this. And then as well, we have an anxiety and faith-based community survey that we have out. Whether you're a member of the OCD community, a faith leader, or a clinician, we value your input and hope that you'll consider completing this. We're really also working towards an anxiety and faith-based initiative where we're actually going to be having a conference coming up, I believe, in May, and then also working hard to make sure that we are supporting individuals in this arena, whether it's for assessment, diagnosis, whatever it might be. So please consider filling out this survey as well, surveymonkey.com/r/anxiety in faith. In general, you can join our virtual community by visiting iocdf.org/peace of mind. This is where a lot of you might say, well, Liz, how do you come up with your random questions? They're not random. They're questions that are pre-submitted in advance. You can go to this link and submit questions that you have so that I can answer them, or Ethan or any of us can answer on our live series. And this is also where you can find all of the upcoming events and series that we're doing. This is also a place where you can submit content that you want us to cover. If you feel like we haven't addressed it or it would be helpful for us to address, please make sure you let us know at this location. Of course, proposals for the IOCDF's annual research symposium are now being accepted. This event will be online July 8th, and poster submissions are being submitted until April the 1st. For more information, you can go to iocdf.org/research. All right, lots of amazing announcements, so many great things coming up. As you guys know, IOCDF works tirelessly behind the scenes to bring great content, but also to really focus on education and support that we think our community needs in real time. So please help us continue to do that by telling us what you would love. Let's hop right in. So my first question for today is, my son experiences mental rituals. It often keeps him up at night until 6 in the morning. He says he is unable or resistant to sleep. Is this a common occurrence in others with OCD? He's tried ERP in the past and numerous OCD medications, but has not found relief. What, in your opinion, can he do to address the resistance he's experiencing? This is a great question, and I have a couple follow-up questions that stop me from being able to fully answer it, but some of the questions I would ask is like, how old is he, and what support does he currently get? Because of course, if we're talking about a young child versus an adolescent or an adult, things and the way we might approach it would be different. But yes, it's very common that those of us, when we're struggling with OCD, especially with more intense levels of OCD and anxiety, that sleep is disrupted. And it's also very common that we get stuck ritualizing, right? Once we start, it's oftentimes difficult to stop, and we find ourselves getting stuck in a ritual cycle. And so both of those do make sense. ERP is the way I would go with an OCD specialist, and of course, a combination of medication as the first line gold standard. And what I would ask is, has it been given in the appropriate dosage? So sometimes medications aren't always given the full trial, as Dr. Goodman discussed on our Lunch and Learn last week. And then sometimes with OCD treatment, ERP needs to be done more intensively. So if outpatient ERP isn't effective, the first question I always ask is, was it done with an OCD specialist? But then the second questions are, do they need something more intensive? So does the individual potentially need something like an IOP? Do they potentially need residential support? What level of treatment might make it where it could be more beneficial if they're still struggling with the treatment intervention being offered? Are there any support groups for teens which are no cost? Absolutely. There's support groups across the globe. In Houston, we have a support group here that's no cost. I know that there's lots of different options and support groups, including one that's run by Wendy Mueller and her group. So please check out Health Unlocked, which is an IOCDF resource where we help compile a lot of this, but also IOCDF has links to various support groups that are available. And I would say actually majority of support groups are no cost. Oftentimes treatment groups have a cost associated with them, but if it's a support group, I would hope that it is offered at no cost, unless it's a really minimal cost to cover like the building space or something like that. What are some strategies for getting through ERP? I have homework that I'm assigned and I can't force myself to sit down and do it because it scares me. I don't even know where to begin. When I think about it, I just shut down. Any suggestions or tips, and what helped you the most? This is a great question, and one that I think we should continuously be evaluating as clinicians when we're working with patients. And the thing I always say is, if we're struggling to complete our homework, I want to know why. There's usually two reasons why. So the first reason is maybe the homework was too hard. Maybe the homework that we had assigned was levels 8, 9, 10, things that we're not ready for, and we need to scale it back so that it can feel more feasible. Homework should feel anxiety provoking, right? We're not asking you to do things that are enjoyable. We're asking you to do things that are scary, that are challenging. But you should feel supported and you should feel willing to do the work. If it's something that it feels so overwhelming, you find yourself not able to engage at all, it's important to ask why. Is it because it was too difficult? You were assigned, homework assignments that are too high level, something you're not ready for yet? Is it because you're not motivated? And what's going on with that? Why do you need what is kind of causing that lack of motivation, and can that be addressed? One of the things that's really important for us to think about is sometimes we focus a lot on thinking that homework should be easy and that we're just going to be excited to do it. That's not the case, right? If it was the case, you probably wouldn't even be in treatment. You would just engage in this ERP work on your own independently. It should be tough, but you should feel like you have support. And so the thing I would always encourage is start doing the homework together in session with your provider first. So get some experience doing it with them in person so that when you do it at home for homework, while yes, it might be tough and yes, you have to push yourself, it shouldn't be overwhelming. And it should be something that feels feasible because you've already kind of practiced it and you've had some experience practicing it. And get to some of these questions that we have. My son is going through OCD treatment through NoCD, and he's sounds like doing well, but having difficulty experiencing his victories or recognizing them or kind of owning them. Celebrate them with them, right? I think this is such an important topic that I love that you bring up, Erin, because so many of us focus on what we still need to do. So, what I need to do is visible. My husband can see the rituals I still do, and he might be one to point out and say, well, Liz, you're not doing this, you're not doing that, you need to work on this, because it's not as visible to see all the work that I've done, to see the success, to see the challenges that I pushed through. And so it's really important that we take a step back and together we celebrate that. And so together, can you have him acknowledge celebrate the successes that he's had? Can he write them out on sticky notes and place them in his room or put them on his mirror, right? What can we do to celebrate our successes and to make them visible and acknowledgeable to others so that they can celebrate them with us? A lot of times those of us with OCD will say things like, well, people don't recognize all of the work that I've done, or they only recognize what I haven't done. And my common response is, true. Have you told them the work that you've done? Right? And that usually we're like, well, maybe not, right? Because if we haven't told somebody, how do they know? If it's not visible and they can't see it, how do they know the work that we've done? How are they aware of our successes? That's really important and critical that we're sharing and that we're working together with that. Is it wrong to punish a child for pulling out their hair by shaving his head? I see this as abuse on my way off. I'm not comfortable totally answering this question. I think that this is something that would need to be answered together with a clinician, but certainly when we think about trichotillomania, hair pulling or skin picking, right? Punishing isn't going to make it better. Punishing is not going to make us stop doing it. And so I think anything that would increase shame or that is a punishment for something that we feel like we don't have control over would not be how I would want to address it. And that's something that I wouldn't be comfortable with. But instead, you should be working with a provider, again, to celebrate the successes versus punishing for the rituals or the behaviors. Hi. So good to see you. Thank you, guys. So happy that a lot of you are going to be taking that survey and you love the anxiety and faith element. Mason said, what does it mean to lean into anxiety? Does it mean accepting uncertainty and leaving it unsolved? This is a really good question. And this is one that we talk often about. I would encourage you to watch some of my videos that I've done with Dr. Grayson, who really talks about uncertainty. But when you think about OCD as a concept, when you understand whether I'm dealing with contamination OCD, scrupulosity OCD, it doesn't matter, right? Whatever type of OCD. What is the core, right? The core of all OCD fears is uncertainty, right? We want to be certain. We want to be sure. We want to know that things are okay. We want to know that something isn't wrong. We want to know that someone's safe, that we didn't cause something bad to happen, whatever it might be. And so the treatment, when you think about that as a concept as well, while yes, it's individualized and yes, it's specific to your diagnosis and what you're struggling with and your symptoms, the core of it is it's all about uncertainty, right? It is all about leaning into uncertainty. And so what does it mean to accept it? It means that we leave it unsolved 100%. And it means that we accept that we can never be certain. When you think about the concept of certainty, certainty is not feasible. There is no way in life for us to be 100% certain of anything. And when we think we are, we're often fooling ourselves, right? I might say like, oh, I'm certain that it's sunny out and this, but like, I can't be 100% certain, right? That's my perception. That's how I understand it. That's what I see. Certainty is a concept that you kind of just believe in and you go with it. And so when you think about accepting uncertainty, what we're doing is we're just accepting that like this may or may not be the case. We may or may not know this, and that's okay. Right? We're accepting that it's okay to not be positive, to not be sure, to not be certain, because positivity, like completely being positive, completely being sure, completely being certain, actually isn't something that we can achieve. And so it's all about leaning into uncertainty, leaving things unsolved, and accepting that that's okay. And I'm willing to take that risk. I'm willing to live with uncertainty, because the attempt to have certainty also means that it's taking away everything in my life. When we think about what happens when we try to have certainty and we allow OCD to dictate that, we give up everything, because freedom and certainty don't exist. You can't experience freedom and be present and be certain, because when we're trying to be certain, all we do is spend our time searching for that, trying to understand that, trying to achieve something that's actually impossible. But when we lean in and accept uncertainty in life, that's where freedom, that's where mindfulness, that's where being present can actually exist. Do you have any tips for being triggered in public, regardless of the theme, and continuing to move forward with your day, regardless of people? You know, it's a great question, Joey. And I think that I would certainly recommend engaging in CBT treatment to get some specific social anxiety or anxiety or panic disorder, whatever's going on, right? But to be able to get some specific treatment for it. But overall, the general concept is about exposures, right? We push ourselves to be in these situations that are anxiety provoking, that are triggering. We continue moving on, and we remove the behaviors that we often do to try to feel better. So if we're triggered in public being around people and we find ourselves being hyper aware, kind of doing some sort of checking behaviors or always making sure we know where the exit is, right? Whatever those sort of behaviors might be that we think in the moment actually make us feel better, make this feasible. Those are the things that actually make this, continue to make that environment scary, continue to allow anxiety to be present. And so it's all about pushing ourselves to be, to not avoid, to live our life, and to not try to be certain, to not try to keep everything perfectly safe, to not try to engage in behaviors that make us feel better, because those behaviors actually continue to allow the fear to be present. I'm listening from the UK at 5 p.m., signed off work with Just OCD. Lovely to hear you and the massive impact it can have. Thank you, Gary. So happy to have you joining. It's so great when we see people from the UK. I see Sylvia from Belgium. Hi, Thomas. I love seeing people from all over the globe and knowing that these webinars can really impact us across the board. It's so exciting. Bring your exposures to therapy. Absolutely, right? That's why we're in therapy, to get that extra support. I had therapy this morning at 7:30. It's something that I do every week. It's important for me. In therapy, it's an opportunity to do the scarier things, to do the things you need extra support with, so that on your own afterwards, you can continue to push forward. How can I prepare someone for treatment and support during their stay? They're going to the Gateway Institute. You know, I think the biggest thing is about having open lines of communication, making sure they know that you're here to support them, how much you love them, and allowing them to help navigate what that'll look like. I think it's really important that when we think about support, the way I need support for my OCD treatment is probably different than the way Ethan needs support, and different than someone else. And the way I want my family to support and be involved, or my significant others, is different for myself, for Ethan, for others, right? All of us navigate that independently. And it's different depending on our needs and what we want, and what works for us. And so what I would say is, be involved to the extent that they'll allow you to be, both the treatment center and your child, and talk about how are ways that I can make sure I'm supporting in a healthy way. What are some educational resources and tools that I can do for myself so that I can be the best supportive parent versus an enabling parent? And how can I make sure they feel that support versus feeling it in any other way? There's great resources for families, available on IOCDF. You can still go to peaceofmind.com, watch some of those videos. There's wonderful books, wonderful resources that exist, but work together with the treatment team. But to get them ready, I think if they're currently doing any outpatient ERP, of course, that's a wonderful thing to continue to encourage and support. But it's often going to be about helping them get ready through education, right? Are there videos y'all can watch together? Is there some literature, books that you can read and be as well versed as possible? But also just helping encourage them that treatment might be hard, but it can be life-changing, and I'm here to support you, and just how proud you are and excited you are that they're taking this step, because treatment's not easy. And it's going to take time, right? Don't expect overnight results, but instead really start to have open lines of communication and talk to them now about how they want you involved in treatment so that you can be involved in an appropriate and helpful way. So important to celebrate every step. Absolutely. Thank you guys. I love this time with you as well. I have OCD and often struggle seeing and celebrating the successes I've had when I have an episode. Even though I've come a long way, it's easy to forget. I couldn't agree more. It's so tough for all of us, right? Because we're our hardest critic, and it's so much easier for us to say, here's what I haven't done, here's what I still need to do, versus here's what I'm doing, and here's what I've done, and look at the successes, and look at where I'm at compared to where I was. How do you live with uncertainty with I'm assuming sexual orientation OCD or harm OCD. I'm not sure which one the question is for. And so if it's sexual orientation OCD, if it's harm OCD, it's actually all the same, right? When we think about living with uncertainty, it's about accepting uncertainty and leaning in. So it's about accepting the fact that everybody lives with uncertainty. Everybody has intrusive thoughts. So they did a research study a long time ago where they had individuals with OCD and individuals without OCD record their thoughts. And then the clinicians were supposed to separate out which folks had OCD and which ones didn't. And they weren't able to, because guess what? Everybody has bizarre thoughts. Everybody has intrusive thoughts. The difference is with OCD, we hold on to it, and it's accompanied with anxiety, and it makes us feel like it's really real. We feel like the thoughts are dangerous. We feel like the thoughts are something that we're capable of or we can act on, even though we kind of know they're irrational. We can't be convinced, right? We can't be totally positive. And so we want to go to these extreme measures to make sure to confirm. It's all about us leaning in and accepting, right? It is about us being able to say, you know what, okay, so I had an intrusive thought. Maybe, maybe not, and moving forward, right? And again, you do this slowly and systematically. You don't overnight, or you do this for all of your fears, or you guys wouldn't, we wouldn't need to be in treatment. We wouldn't need to seek additional support or help. It's about doing it slowly and systematically. So what are my lower level fears that I can start with leaning into uncertainty, doing exposure with response prevention for, and then slowly moving up to the higher level ones. So good to see everybody. I find it difficult to have a hierarchy that we're constantly working on with our son. It's effective to help him do exposures in the moment and to work hard to not accommodate and reassure him. Absolutely. So Katie, it's absolutely effective to work together in the moment with whatever's coming up, to not engage in reassurance and to appropriately support someone you love in doing exposures and helping them kind of push through that. As far as the hierarchy, sometimes it is hard because OCD can shift, it can wax and wane, and so you'll get started and new things come up. But again, I would really work together with a treatment provider to come up with a plan and to think about how you can best support. Sometimes the support is, it's one of those things that it looks different in every moment, right? If we're in the middle of a crisis and we're overwhelmed and we're super anxious and we've got homework to do and it's due in an hour, how do we manage that? That's more important than going to the hierarchy and starting a new exposure in that moment, right? Because that's not going to be useful. You have a task you have to complete at hand and something that needs to be addressed for someone to move forward. So it's about kind of balancing, but it's also about doing what they're ready for. Sometimes those in the moment exposures might be too high level, that we might need some distraction, some other support in that moment because we're not working on those yet. And we slowly work on the ones that we've agreed to work on in treatment. And this is why working specifically with a provider is so critical, so that you have an individual treatment plan that you're slowly working towards that's much more attainable. I think just trying harder, Lana, would be potentially our inner critic, right? And it's important for us to know that we all try our best. And sometimes we have good days, sometimes we have tough days, but give yourself a pat on the back. Acknowledge the progress you've made. And maybe the progress is you got up and made it to the restroom, you had a glass of water for the day, you sat outside in the sun, right? It doesn't have to be these huge, significant milestones or even ERP or OCD triumphs, right? It's little things that are huge successes for many of us that we have to sit back and acknowledge because those are meaningful. What does your daily self-therapy and ERP look like? I graduated IOP at the end of December, and I try to spend 10 minutes every morning, and I'm wanting to make sure I'm effectively managing OCD in an ongoing context. Erin, this is a great question, and I think the answer is it's really dependent on you. It sounds like you have an amazing plan in place and you're doing great work. For me, so I go to therapy every week. I still see my therapist Wednesday mornings at 7:30. And we really talk about what I've been triggered by, what's going on, and kind of set ERP and homework for the week. And for me, ERP is something that I try my best to actively engage in every day because as we all know, it comes up all the time, right? There's opportunities and situations where I can lean in, I can do ERP, and I should be, right? It's meaningful to do so in the moment. There's also times where I need to set specific ERP goals, right? If there's something I'm avoiding or something that I really don't want to do that I need to set and focus specifically on. So it really depends on the week for me. Everything is different, but ERP is a lifestyle, right? It's about every day when we have opportunities to ritualize or opportunities and choices to lean in, experience uncertainty, and do ERP, which are we choosing? One will feed OCD, the other one will diminish OCD. And so we know which one we should choose, but it's about pushing ourselves. And I think that it's important that we're always like gathering information. And when we gather a certain level of information that kind of tells us, we need to up our ERP or, right, that information often comes from rituals or distress, right? If I see things are getting worse, OCD is picking up, then I probably need to increase my ERP. But if I'm managing it well and we're doing the 10 minutes a day, like that's a wonderful tool. So it's all about what's working for you. And no one knows yourself like you know yourself to say, oh, I need to up it a little bit. I have a 9-year-old with ASD, that's autism spectrum disorder for those of you who don't know, and OCD. We stopped OCD therapy to focus on very intensive ABA therapy, which does address some of the issues. We thought he was not quite ready for ERP, but his OCD has become worse. He's now secretly eating soap to stay clean. Any thoughts on what we can do? Absolutely. I think you need to get to a specialist who works with ASD and OCD. That does exist. So like here in Houston, we have a provider, Dr. Melissa Fastow, and there's some others who really specialize in comorbid ASD and OCD. But in particular with digesting soap, that's actually really dangerous. And so I would want you to seek immediate medical advice for that to be able to address and see if there's been damage done and what needs to be addressed, and then be able to really focus on this from a medical intervention and stability point when it comes to safety. That's number one. But making sure that this OCD is being addressed, right? It certainly can't be ignored if those are the sort of behaviors happening. So see if you can find somebody who does both an ASD intervention and an OCD intervention simultaneously, but make sure you get that addressed right away, especially from a medical perspective, because of the dangers that can come with it. OCD feels like assigning unlearned weight to your intrusive thoughts. It is interesting how strong OCD is and how much it can feel, right? Like the feeling of it, the weight of it. But remember, treatment works, and it can get to a point where our OCD thoughts feel weightless, and that's a remarkable place to be. I have OCD and a real problem with judgment. Often I lash out in anger, and those who perceive to be negatively judging me. Is this common with OCD? You know, I think that anxiety is common with OCD, and it makes sense that a lot of us, especially if we're struggling with OCD, we feel overwhelmed, we feel anxious. I think that it's common for people absolutely to have anger in conjunction, but it's not necessarily a symptom of OCD. And so it's important that you're working on both and that you're getting treatment for both and able to kind of work through both at the same time, because they may go hand in hand, and one might actually increase the other, you know, one might increase the other. So if we're angry, it might increase OCD symptoms and vice versa if we're not dealing with both at the same time. Lots of moms with kids who have OCD right here. Any support groups for moms raising kids? I think there are. So I would absolutely check out the resources at iocdf.org. I think there's some amazing support groups, and sometimes support groups will break out for parents and caregivers versus individuals. And then, of course, there's lots of resources for families and parents, and we are going to continue to increase our education and webinars for families and parents because we know there's a big need for that. As a fellow member of the OCD community, Rebecca says, I'm so grateful to see you, seeing someone like you who I look up to so much, and hearing you talk so openly about how you still struggle and how you're one of us makes me feel less alone and empowered. It's my pleasure, Rebecca, and it's an honor to serve in the role that I serve in and to be able to walk alongside the OCD journey with so many of you, hopefully knowing that you're walking alongside mine as well. Thomas, couldn't agree more. We've got to acknowledge our progress even when we're struggling with other things. So remember, right, sometimes with OCD we get stuck in our head. There's lots of different reasons we have intrusive thoughts. You want to work specifically with your provider for specific questions. It's hard for me to answer some of them, but to kind of best understand what's going on and how to deal with the thoughts. All right, that is it for today. I've wrapped up the questions in just half an hour, so hopefully you still have plenty of time to eat lunch during your lunch break if that's what you guys are on right now. And I mean it when I say it. It's a humble pleasure of mine to walk alongside so many of you. I'm going to share my own personal news because I think that it's time. I wasn't planning to today, but I will. And it's been really interesting for me. And so you guys are going to see me take a little bit of a breather and a hiatus. I'm going to take some time off from live events starting in May for a couple of months and really focus on my life and some personal things happening. I'm actually expecting, so my husband and I will be welcoming our first child into the world in May. And so I'm going to take a little bit of break from live events. I will not be gone. I will still be doing advocacy and I'll still be actively involved. But I wanted to share that with you because there's a couple reasons. So the first is that I'm going to start sharing a little bit about my journey with pregnancy and the perinatal phase with OCD. It's been really interesting. My first many months where I was quite sick, and it was really fascinating for me, the struggle of pregnancy nausea and anxiety and trying to differentiate and understand what that would be like and how I can navigate that. So oftentimes when we feel, you guys know, when we feel uncomfortable, when we feel anxious, we treat it all as OCD. And I think that for me, it's been a journey. It's been really interesting of like, okay, this is nausea, this is different. But what I found is that my mind would often race automatically when I felt anxious or I felt uncomfortable, or nauseous actually, because it was typically a sign of pregnancy. For me, my OCD was trying to, or my mind was trying to race and find and attach meaning to something to try to understand why I felt this way, when I actually felt this way because I was pregnant, not necessarily because there was an intrusive thought to be worried about. So it posed a lot of different interesting difficulties and a new way to navigate things. I also think that my greater good and perspective has certainly shifted, which has been a blessing for me. But I wanted to share that with you guys. I know that you see me on Zoom, so you probably may not have known and certainly can't necessarily see that I'm expecting. I certainly am. But I will be having a baby in a couple months and welcoming them to this world. And that is something, I'm very excited and honored and blessed to be able to do, but is also something that I know will impact my OCD in various ways. And I want to be a voice for that. And I want to be able to share openly. So I encourage you, if you have questions, you guys know I'm an open book and I'm happy to share any advice, any feedback, any thoughts, and my own perspective that I can and that makes sense. The one thing I'll say that I'm most proud of, and I want to encourage all of you to work towards this, is that I've spent my whole life being really afraid of being quiet, of being still. Because often being still and quiet sucks. OCD intrusive thoughts are increased, and it's a scary place to be when we have to sit and deal with that. And so I've spent most of my life being really busy, whether it's through advocacy, work, life. I'm not somebody who sits and and just enjoys quiet time, because I've struggled to always do that. And so that has been a new mission for me. How can I be still and be present and find joy and pleasure in that, versus running and avoiding and staying busy in an attempt to manage my OCD? And what I've learned actually is that I've surprised myself lately. COVID has made us all slow down a little bit, right? I can't do all these speeches and events in the evenings and different things. And so I've had to slow down. I've had to kind of take things at a different level. Simultaneously, however, I've actually been pretty surprised that I've found enjoyment and pleasure in it. It doesn't mean it hasn't been different for me, and it doesn't mean I don't still, want to just stay busy when I wake up in the middle of the night, or if I have an intrusive thought, my urge is to distract and stay busy, if I'm not ready to do an active exposure or ERP in that moment. But what I will say is that you can have OCD and you can be still and you can be present and you can experience joy. And I'm really proud to be sitting here and be able to say that, because it's something I don't know that I would have believed 5-7 months ago. And of course, with this new life journey for me, I am placing a lot of emphasis on how important that is, right? I want to be able to do my best, to be in the best headspace, to be able to be present. Does it mean I'll always be present? Of course not. Does it mean I'm not going to have intrusive thoughts? Definitely not. But I can't be afraid of slowing down. And I want to encourage you all to really think about, what are the things that we avoid because of our anxiety or because of our fear of how OCD can impact that? And how can you make that a huge goal to work towards? Because remember, when we have greater good goals, goals that have really big purpose and meaning behind them, it's much easier for us to fight than if our goal is just to get up in the morning and fight our OCD. So I want to encourage you, always keep in mind what you're fighting for, because when that is at the forefront, it's a lot easier for us to do this really hard work. And what I want to say most importantly is that freedom, peace, joy, sure, not 100% of the time, but they're all obtainable despite our diagnosis. Remember, help and hope are always available. I'm excited to have you guys in this journey and to continue to be with you for a couple more months before I take a breather. Thank you for your amazing comments. It's heartwarming to me, and I'm excited to be able to share in all that I do and have such an amazing community behind me. Remember, help and hope are always available. See you guys in a week.